Yes, yes, we can start.
Good evening, teachers. Can you please switch on your videos? Yeah. So we extend our warm welcome to all the teachers for this program. Hope I'm audible to everybody. Okay. So Teachers' Day is celebrated every September 5th to honor your contribution for brewing the buddies of today. But many of us remember our childhood teachers on par with our parents. It's because of the difference you make in our life. The inhibition that you break, the motivation that you give, and the possibilities which otherwise would not have been happened to us. So, what many of us don't think is your health. In fact, teachers yourself, you don't seldom think about your health. And the pain that you have to endure while trying to implement your teaching aspirations is actually due to your past negligence. So if diet and lifestyle awareness materializes, then a majority of your health challenges will be averted. So in today's session, we are trying to attempt to highlight important aspects of health specific to teachers and how Ayurveda answers to many of their occupational disorders. So we welcome on behalf of Heavenly Fuel Private Limited Chennai, Dr. M. Harikrishnan, who heads our R&D department. And let me give a brief about our speaker today. He is a practitioner since 2005. He is into drug research and development, and his area of research interests are Ayurveda dietetics, Ayurveda for current day lifestyle and occupational challenges. And he practices at three places in Chennai, one in Besant Nagar, another in Mylapore, and he has his own clinical place in Westmamblam, Chennai. And he also does online consultations for all the patients around the globe. And he also works with a startup company called Heavenly Fuels. And a brief about the company Heavenly Fuel, who is conducting the program today. So the company was founded in 2016, instigated by an emotional reason. So the company is into Ayurveda research for chronic diseases, including renal disease, pain management, stress and sleep disorders. And the company developed a promising oral dispersible tablet for mouth dryness. And they are into a pilot study in the Adyar Cancer Research Institute, Chennai. And they
Sorry
are
to
also coming
interrupt.
up
Can
with,
you increase the volume, please? We cannot hear you too loudly.
okay, so probably I should
Thank
come a
you.
little closer. And they are also coming up with more unique solutions for common chronic diseases of today. So that's all about the company. And I again welcome on behalf of Heavenly Fuel Private Limited, Dr. M. Harikrishnan, to take over the program and take us through. Welcome, sir. It's all yours.
So, good evening, everybody, all the teachers. You are special today. In fact, we wanted to conduct this
Doctor, we
program.
can't hear you.
Um,
It's very faint.
faint.
Are others able to hear him?
It's very faint.
Yeah, it is easy. Yeah, it is
Uh,
audible.
Is
I
it
think, ma'am,
audible?
you
Am
have
I
to increase.
audible?
Yeah, it is clear.
I think you have to
I don't
increase
know
your
why I
device
cannot.
volume.
Maybe I'll leave and join again. I can hear it very faintly.
Okay,
Okay.
okay. So, let us begin today's meet with a prayer. So, we all prayed Lord Dhanvantari, Namami Dhanvantari Madidevam Surasurai Vandita Pada Padmam Loke Jarar Bhayamritvinasham Dataramisham Vividaushadinam. So, you are all very special today because the topic of discussion is about the problems which you go through, and should have been day before yesterday, that is on Teachers' Day, but we didn't want to remind you all about all the problems you face because that's the day when you need to be credited. But today it's about taking care of yourselves, how we can, how Ayurveda can contribute for your betterment, and how your aspirations and ambitions can be fulfilled by taking care of your health. And this list is, it need not be complete, but it's almost, I think we have compiled a list of conditions which the teachers of today, and more often what we mean by teachers is the brisk active teachers who are taking care of the school children, because it's that particular academic side where teachers are really working hard, because it's not that people at college level they don't do that, but in teachers who work at schools, it's relatively more. The hard work is more. So, of course, they all go through the common lifestyle disorders, not all, but many of them: diabetes, hypertension, obesity. What we find is stress induced diabetes, hypertension, which is linked to stress, or hypertension due to sleep issues, or hypertension due to other factors which could be related to the heart or other lifestyle causes. These are more in teachers who teach at schools. And migraine, yes, it is an occupational disorder of teachers. We find most of the patients who complain of migraine, they are currently teachers or they would have been teachers in the past. That's what we see. And low BP. In fact, what Ayurvedically, if we look at it, migraine is a problem which is because of pitta association with some other factors, and low BP also along with blood, pitta and association with blood. So what we find is, only if a person has very active pitta by birth in the constitution, and if they happen to be blood based body, their component is dominantly blood based, then they have more drive to go and teach. Only if you have drive to teach, or you have that motivation, people will be in this teaching field. So people of this
Sir, sorry
constitution.
for the interruption.
Yeah,
You're on the wrong slide. I think you should move 4
yeah,
slides further.
yeah. No, I think this is the list. Now, why I am starting here, because I want to start with the list of disease and then go to the problem, the lifestyle mistakes that teachers make usually. That's why I want
Because
this
we are
to.
seeing only the first slide.
Doctor, can we get a recording of this? Will we
Yeah, you
get?
can get it. We are trying to record it. We will let you know, ma'am.
Oh,
Yeah,
thank you.
yeah. And then allergies, of course, allergies. Uh, if unless and until there is a heredity issue with regards to allergies of the skin, it's not very common. Skin allergy is not very common in teachers, but there are respiratory allergies in majority of teachers. Most of the teachers who write a lot on board, there are schools where still teachers write on board using chalk piece. Respiratory issues, sore throat, of course, they handle more than 4 hours a day. Many of the teachers handle more than 4 hours a day, and that itself has a telling effect on the throat, and the vocal cord goes for a toss, and that results in a lot of strain and repetitive strain injury, rather we should say, for that. And whatever they go to doctors and they take some medicines, and they take repeated doses of antibiotic course, and doesn't help. It doesn't prevent the problem. So what should be done for that? That they need to know. And then early arthritis. So most of the schools, they don't have escalators or lifts, and they just have to use the staircase, climb up and down, and stand for long hours and teach. And added to that, because of menopausal issues, and they are nearing menopause, and the diet not being that great in terms of nutrition, osteoporosis also sets in very early for teachers, and spondylosis. I didn't mention frozen shoulder here. So teachers also lose out on the strength of their shoulders, because they spend a lot of time in writing on the board and correcting, and so these are all the issues related to the joints of the knee, and the bone health, and the neck. And varicose vein, yes, this is again another problem due to prolonged standing in teachers. Calcaneal spur, heel pain. The heel pain can be due to spur, or it can be due to some inflammation of the muscle fiber called bursitis we say, or it can be an athlete's foot, or plantar fasciitis. There are various other versions which can lead to heel pain. Either it should be a bone related issue, or it can be due to an associated structural issue there. And then gynecological issues. It's not that all teachers are facing gynecological issues, but if there is negligence, then the lifestyle of teachers can contribute for gynecological issues. It can even take its root from the my mental part of it. If stress is there deep inside, that can reflect as some gynecological issues like fibroids, etc. So, and then gastritis. Because of academic commitments, they don't take food on time, or they take very little food, and they have to start early in the morning, and they just have to pack things fast, and the food they take is either too acidic, or too little, or less in nutrition. And ulcers, which is a further aggravation of the problem, leading to ulcer. Gastritis leading to ulcer. And then kidney stone, because they don't take water. It's not that people have to gulp large quantities of water, but they need to be aware of water requirement. It's not that they just need to take it only when thirsty, but even otherwise they need water intake intermittently, preferably lukewarm water. And urinary infections, of course, it's another outcome of less intake of water. Gallstones, taking too much of nuts, cashew, because these days people advocate a lot for taking nuts, and they say about proteins and all. But if that doesn't digest properly, and if water intake is also not that great, then that's going to lead to issues like gallstones, especially in middle age for women. And hypothyroid, it's out of 10, you find at least 5 people suffering from hypothyroid in women these days. So these are the issues which we find, we we recollected while listing down the choice of teachers. It's not about choice, it can be due to the commitment, the professional commitment also. So prolonged standing and climbing staircase frequently, continuous or more hours of talking, not attending to nature call on time, especially hunger, thirst, and urination. And this I already discussed. So low water intake, and then synthetic fabric. This is something which people need to, because synthetic fabric, it's easy to maintain and make it look. It's easy to make it look good, but it's not that great in terms of contribution to health. And then neglecting the scalp. No, it's not. I'm not going to talk about hair fall or dandruff here. When we take care of our scalp, just applying hair oil, coconut oil over the scalp, it's not just going to maintain the hair health, but it's important for stress relief, better sleep, and there are various other things also. Towards the end, we can see about that. And not giving importance to health, that's an important point to make here. And sleep also. So in the process of completing the work, they keep working for hours together. They extend their working time at night after they have to combine their domestic commitment with academic commitment, which is a big challenge. And stress, of course, can be professional and personal. Professional in terms of achieving targets, and personal can be variable. So all these things are not all of these are relevant to everyone, but we can find a mix and match of these factors playing a role in teachers' health getting affected. So to start with, a few recommendations. So avoid acidic, spicy food. Very easy recipe to make is sorry, tomato rice, lemon rice, tamarind rice. Yes, it's fine, but it need not be on a regular basis. It can be once a week. So make it a point to include such an acidic food and sour food, which is a mix with chili also, just once a week, and rest of the days distribute other types of rice. Say there are other types like gooseberry rice, coconut rice. If people who are using roti, then better they limit the use of tomato in gravy part, and use something else like dal, or which with added this ajwain, etc. So include more of green vegetables. No sprouts, please, because sprouts will definitely affect. It will cause joint pain much quicker, and it doesn't digest that easily, and it increases, in Ayurvedic terms, it increases vadam, it increases pain, dryness, and degeneration will be faster if sprouts are used regularly. Better avoid sprouts. Of course, there's a lot being talked about sprouts being highly proteinaceous, but it's not just about nutrition, it's about the ultimate properties it carries with it. And green vegetables, in the sense, what we mean here is use of vegetables like bottle gourd, snake
The
gourd.
slide is not visible. Can you please go to the relevant slide? We are in the first slide, Ayurveda for teachers.
Others are able to see the slide? Can someone tell?
It's come now, yes.
Yes.
Is the slide moving now? Is the slide moving?
Yes.
Okay. So use gingery oil mostly for cooking in rainy season. So we have different types of oil available in the market. Now cold pressed and wood pressed oils are very common. But we can make a choice here. Use gingery oil mostly for cooking in rainy season. For winter, we can use more of coconut oil. Or we can use mix with 70% gingery oil and 30%, something like that. We can change according to the season. And for summer, use more of ghee and coconut oil for cooking. Mustard oil is used very commonly in North India, so that can be a choice in colder months, uh, especially if people have severe ulcer and gastritis. Better avoid mustard oil and gingery oil. Use ghee and coconut oil. Whereas in North India, ghee can be used across all seasons, and based on the availability, sesame oil and sunflower oil can be used in rainy weather there too. And more importantly, eat on time. So most often teachers carry the breakfast to their school and have it there, so they can finish the breakfast before 9:30 a.m. if possible. And lunch, sorry, here there's a thing missing here. So lunch before 2 p.m. is what I meant. I'll make a correction right away. So there are people who take direct brunch. They don't have any separate breakfast plan. So they go for the meal, full meal directly. So that can be done between 11 to 11:30 a.m. ideally. If that is possible, then nothing like that. That's the best way to handle diet on a day-to-day basis. So they can skip breakfast for direct meal, but they should have something, a kanji or a porridge in the morning with milk preferably before 7 a.m. If they have irritable bowel syndrome, better they can go for buttermilk based kanji or porridge in the morning. Before I mentioned here 7 a.m. because they leave at least by 7 a.m. earliest by 7 a.m. I suppose. But if they are leaving much later, they can have by 7:30 also. So science, math, and here I have mentioned something. Assuming that these people are falling under the Pitta type of constitutions, because whether it is physics or science or math, or wherever there is more of calculation to be done, or a lot of math related activities there in subjects related to those, then coffee and tea are to be avoided by them. In fact, these drinks will make them very active and get more involved in the process in their projects. But it's not going to do good any good for their mental health as well. Not only just stomach, but their mental health will also be affected. They may not get good quality sleep if they habituate themselves to these drinks. So they can go for herbal tea or palm candy mix milk with herbs. These things are available in the market. If you want, I can tell the specifics later on. And then drink lukewarm water 60 to 100 ml every hour, and additionally based on thirst and need. So thirst, definitely we are prompted to drink water, but apart from that, make it a point to at least take this much water once in a while, at least every hour. It's not like you need to drink 2 liters of water at a time, morning, empty stomach. That's not the right thing, which Ayurveda says. In fact, Ayurveda says have 1 glass of lukewarm water, which amounts to 120 to 150 ml early morning. That's all, not more than that. And this habit of taking hot water with honey for weight loss, or that's really bad. Never mix honey with hot water. In case if somebody is looking for weight loss and wants to use honey in that particular attempt, better to go for normal boiled and cooled water, which means the water which has come to normal temperature. Just add 1 teaspoon of honey to 150 ml of normal water, boiled and cooled water, and drink it, not when it is warm. So old raw rice can be used in winter months because it is very much digestible and it gives good strength. Otherwise, boiled rice or hand pound rice is preferred in other seasons. So across in South India, people use these millets, little millets. So these things can also be used, and preferably kodo millet and foxtail millet is good for people, even if they have joint pain, metabolic issues, hypothyroid. People usually are prohibited from taking millets, but if they have good metabolism, because they may be taking some tablet which might have corrected their metabolism issue, so they can go for these millets. And this barnyard millet is slightly heavier, and it can help in irritable bowel syndrome and inflammation of the gut. So there it is useful. It can reduce the frequency of loose motion. So for that, this barnyard millet is good. So suppose a person, because most of the teachers go through this sore throat or cough, so they should, if they don't have sore throat or cough, then they can take this vetiver water. They say ushir in Hindi and Sanskrit, we say ushir. So that's vetiver water can be taken in summer, in hot days, or even during hot days. We can expect hot days in other seasons as well. So sensing that, you can use this ingredient. But in winter, better go for dry ginger boiled water. We can add little mulethi, we say in Hindi, or adi maduram in Tamil, we say, and eshti madhu in Sanskrit. So that can be added to water and boil it, and that can be taken intermittently for as a drinking water. So buttermilk is good only in summer and hot weather. And avoid snacking with maida or besan flour. Limit the use of. So this is particularly mentioned to highlight the prevention of gallbladder stones, especially besan flour. So also cashew nut is also the culprit there. Cashew nut and groundnut. Limit the use of beetroot, cabbage, cauliflower, broccoli, and mushrooms. All these are Western vegetables actually. So they don't sync well with our health unless we have a strong metabolism and very good water intake and very good exercise habits. So unless we have that physique, these things are not recommended on a daily basis.
Sir,
And
can you please move to the next slide?
is it visible?
No, diet suggestions is what we are looking at.
So roti and basmati rice, sona masuri rice, or raw rice to be used in equal proportion for people who are from North India. So pure roti-based diet culture to be avoided. They should use some quantity of rice every day, or at least 3 days a week. That's what we always recommend. So next, coming to lifestyle. Is this slide
Sir, we are
visible?
not seeing the slide. No, you are in the diet suggestions.
Doctor, the slide, what you're talking is not seen on the slide. I think you have not moving the slide. The slide is not moving.
I think, is it moving now?
Yes.
Now
Yes.
it's coming. Choice of food.
Food.
I think that's an issue with
Choice of
internet here.
food.
Yeah. Okay, lifestyle. Is it coming? I am on
Choice
lifestyle.
of food is no. You are on choice of food.
Now it's on choice of food.
So I have changed my slide twice. I don't know why it is not changing.
Can you move to the next one? Try moving to the next one.
I think we can. I will send the slide also. So you
Yeah,
can go through
PDF.
that later. So let us get into the discussion. I'll just use it for presenting now as of now. And for lifestyle aspects, when we see there, better to go to bed before 10:30 p.m. I know it is very tough for people to fulfill this criteria. We have heard of people, teachers, being awake until 1:30, 2 p.m., 2 a.m. even to complete their academic works. So, but the right thing to do is to go to bed before 10:30 p.m. and wake up after 5 a.m. Even this duration of sleep, so hardly it's about 6.5 hours. It's not sufficient, but at least it's not bad. And walking can be within the school campus during working hours or at the time of commutation. Yeah, people walk from the bus stop to their home or the school or within the campus. They do a lot of walking. But in case if that is not the setup, then they can go for exclusive walking if they have time in the morning, but they can go in the evening also. Evening walk can contribute a lot for, in fact, for weight loss. So morning and evening raised leg exercise is needed. So this exercise is specially recommended for people to prevent varicose vein and also to improve the flexibility as well. It also helps in low back issues also. So apply warm gingery oil over the feet and heels, followed by soaking in salted hot water. This most of us know about this, but just it's a reminder. This habit, if it is done every day before going to bed, then it's going to help a lot. It's a very good stress buster actually. It will give sleep and it also relieves pain in the feet. Keep a pillow under the feet and sleep at night. This is mandatory for all teachers who stand for more than 2 hours every day to take class. To prevent calcaneal spur and varicose vein, make it a habit to do leg massage with gingery oil every 2 days, half an hour before going to bath. So actually the method recommended is to apply the oil in the upward direction with some force, especially when moving through the calf muscle area. So in that upward direction, they have to apply oil so that the veins are strengthened. So, so what's to be done while being at the school? So while taking class, if possible, avoid prolonged standing. Instead, if at all you are standing, walk intermittently and write on the board or take class. So that will ease out the pressure on the lower limbs. So if you just keep walking and take class instead of standing at a place for a long time. And then during free hours or correcting books, sit with stretched legs, keeping them preferably on a small stool. So that is again going to contribute for prevention of varicose vein and strain on the heel bone. So teachers who use board every day for writing must apply heated sesame oil or mustard oil every day to neck, shoulders, arms up to the fingers, followed by warm water bath or placing hot water bag over the area. I hope I am audible, right?
Yes, you are.
Yeah. So this is very much recommended for all teachers because it's going to ease out the strain on the neck, shoulders, and arms. So applying oil, heated oil over these areas is very important. Regular use of coconut oil over scalp ensures not just healthy hair but also reduces stress, as I was telling before. It's good for improving the quality of sleep. There are specific, now is that point which I wanted to make earlier, that is, there are specific scalp oils. There are many people will ask this question. I have sinusitis, I have allergy, I have asthma, and I have migraine, I have eye issues. Yes, there are different types of scalp oils, hair oils in Ayurvedic medicine for allergies, sinusitis, migraine, headache, asthma, eye diseases, ear diseases, disease of the head, other diseases, and then throat disorders. For all these, there are exclusive oils, so nothing to worry. So they can be recommended uh, specifically, and that can help them in overcoming the problem and help them overcoming the stress also. While retiring to bed and waking up, do slow breathing and observe your breath. That's very important. This um, breathing with awareness. That's a very good stress buster, and it gives that calmness, and it reduces the flow of thoughts, whatever kind of thoughts they are. So these were the queries which we received. This slide is visible. Is the slide moving at least now?
No, sir. We are still on choice of food only. Slide did
Yeah,
not move
yeah.
at all.
I think you have to stop presenting and go to the slide and then start presenting again.
Then eat a lot of time then. What's the issue?
That's fine. At least they'll get to look at
Okay,
the
so these
slide.
were the queries received in the registration form.
Doctor,
So
if you'll be sharing this presentation, I
yeah,
think
yeah,
it's okay.
will share. I will share it. So neck and shoulder issue. This was very commonly asked, commonly filled in the registration. Then weight gain, thyroid issues, digestive problems, and allergy, asthma, respiratory problems. And see, there were a lot of inquiries about diabetes and hypertension. And based on Ayurvedic understanding, we need to see the patient individually or ask questions and then understand the body type and the lifestyle and diet choice, diet culture, and then decide the kind of treatment they should undergo. And the possibility of getting cure from diabetes is something which cannot be said in a single statement. It's variable, no, based on the age, based on the duration of the problem, based on the person's body type. So it thinks there are many various things there. And hypertension, I think most of the teachers they would be taking some tablets for diabetes and hypertension. But what Ayurveda can do, is it possible to come out of the conventional medicine for diabetes and hypertension if we go for Ayurveda? So most of the people have this opinion that Ayurvedic medicines are without side effects, and it's better to switch over to them and continue them for lifelong instead of going for allopathic medicine lifelong. It's not like that. Any medicine for that matter, the intent should not be to take it lifelong. But at the same time, if that is the only option or that is the only prognosis which the doctor has ascertained, then the choice should be towards a medicine which is less harmful. That's right. But what I wanted to convey here is there are so many medicines available in the market. You know, if you go to Amazon or any other e-commerce platform, there are various Ayurvedic medicines for diabetes and hypertension. So you find most of them will be supplements rather, and they'll be coming with the tag of Ayurveda. And for hypertension also there are various medicines, but some of them have herbo, mineral, and metallic ingredients also. So what we can do is to understand the real problem and then go for the medicine. Maybe towards the, suppose you are taking an Ayurvedic treatment for diabetes and hypertension, if your things are brought under control and to prevent any further uh, fall back to the problem, better go for a supplement. Uh, After getting an informed decision is better in that case. And there were inquiries about liver cirrhosis that should have been probably due to fatty liver, unattended fatty liver, because teachers usually liver cirrhosis happens due to acute infections if not treated properly of chronic hepatitis carriers it happens, or most often it happens in alcoholism, but in teachers it happens because of this something called NASH, non-alcoholic steatohepatitis, or fatty liver also. If it is not attended, usually fatty liver is not that harmful, but it is just a lifestyle issue. It is a kind of sedentary lifestyle related issue. If somebody goes for exercise and becoming very active, uh, then that fatty liver also can be brought under control. But this liver cirrhosis is something which is not very common, but at the same time, people should have this awareness that fatty liver is not harmful. At the same time, it is not to be neglected. People need to make some correction at that stage itself. And a lot of inquiries were there about ankle joint pain, flat foot, spur, bursitis, fasciitis. I mentioned about all these in this presentation. Some daily remedies were also covered in that. And in case if you have any other queries, you can contact me as well. And knee joint issues and varicose vein, of course, it's a big topic. It's not that varicose vein happens only to people who are overweight, it happens even to moderately built people. So it's not like that. So that they need to be handled with equal care. And then low back pain, it's one of the strongest areas of Ayurveda. Knee joint issues, they are treatable, but the success rate depends on the extent of damage and age and how well the person responds and how well the person implements whatever has been recommended. And menopause issues, yes, they are really uh, affecting the teachers' performance. So in that case, they need to be based on pitta type of body people. If they are going through menopause issues, then it's even more tiring and even more challenging. So the type of body constitution and the kind of menopausal issue need to be understood before commenting on that. And generalized fatigue and tiredness, whatever diet has been covered, you can go through that. But apart from that, what I would rather recommend is something which is friendly for both diabetics and non-diabetics, that can be helpful in preventing the fatigue. So better if in case if you don't develop allergy, you don't have any cold or something like that, you can go for some supplements which are uh, rich in contents like amla, uh, muleti, that is HT madhu, and then pomegranate based. So these things can be taken, and can also mention some, give some link regarding that in the group. I can post some link about some supplements which help in preventing such fatigue. And anemia, of course, there are direct iron containing medicines in Ayurveda and non iron containing medicines also there. Date fruits are very popular, grapes, raisins are popular, but there are gooseberries also good for anemia. There are various other sources as well. And for prevention of osteoporosis, I had forgotten to mention one point, that is use this Hajjod. Hajjod is perandai in Tamil. That is, it is very good for bone health. It helps in better absorption of calcium. So that is to be added in the diet on a regular basis, at least once or twice a week, in the form of either a sabji or even a powder will do. Just add that powder to the flour batter you use for idli or dosa, and then you can just make dosa with it. And then irritable bowel was very commonly asked also. And for that, I had mentioned a point about use of buttermilk for porridge. And irritable bowel can also be averted by reducing stress and also reducing the content of spice. You know, this chips, spicy masala content, these things, if they are reduced, then the symptoms of irritable bowel will come down automatically. So just a brush up, heel pain, oil application, dip in hot water and use soft bed chapels. And then varicose vein, reverse oil massage, internal medicine may be needed. Most often it is needed. And then calf muscle pain, take more of watery fruits, less spicy, less oily diet. That's very important. too much of dry roasted diet should be avoided for people who have these cramps. And then skin issues, tomato, brinjal to be avoided, coconut oil to be used for diet. And then for neck pain and other shoulder pain, knee pain, low back pain. So the pain comes late. It is not that only when the pain comes, it means the problem has started. Actually, pain expresses after the problem has traveled for some time. So its absence also doesn't rule out the problem. That needs to be kept in mind. So neck position and exercise needs to be uh, followed correctly. So this we have a lot of content available on YouTube and also across the net. So you can go through that. And for back pain, lie on a flat surface. Daily low back massage with ginger oil will do a lot of help. And knee pain, simple knee exercises and regular oil application. Osteoporosis, as I said before, ashwagandha and hajur supplements are good. And so far, this is the place. These are the places where I practice, and I am based out of Chennai and involved both in clinical practice and research work. But now I open the discussion for questions. This is what I am more interested to. I just want to listen to your questions and answer more.
Can you please stop your presentation, sir? Yeah, you can ask questions with regards to any particular health issue or any general queries regarding Ayurveda. You're free to ask the questions.
Okay, good evening, sir. Myself, Usha from Bangalore.
Yeah, good evening.
Sir, so that means you don't recommend the carrot and beetroot juice on a regular basis in the empty stomach?
Beetroot, I don't recommend much. Carrot, okay, but see, anything which grows under the soil, it's
Oh,
not to be used that frequently. It's not just because, like, it's not a Jain kind of approach there, but Ayurvedically speaking, it is Prithvi Tattva, it is earth element. So, anything which is earth element, it needs a lot of digestion. Digestion just doesn't stop with the stomach, but it also happens. There are three more stages. We say five Mahabhutas. There is digestion based on that. So in that stage, this earth element starts accumulating in the body. So what we say is, unless a person needs that, better not go for it. It's not like this A to B, what we call this ABC juice. That is
yes,
not
yes.
recommended for everyone. So we need to take, and even if somebody is recommended to take that, it's not correct to take it every day. Maybe once or twice a week is fine, but not every day. And this habit of taking juice, especially in cold weather and in rainy season, in empty stomach is not right, because Ayurveda doesn't recommend use of salads or any such thing which is not boiled or raw should not be taken in empty stomach.
Yeah, actually, my practice is what I do. When I take it as a raw, I feel bloating. So what I do it as a semi-boiled, and then I'll make it as a juice and then drink. In that is also not fine, sir, on regular basis.
Instead of that, what you can do is maybe you can do once a week like that, but rest of the week you can make a mix and match, like carrot, then bottle gourd, snake gourd, or Indian vegetables. Include more of Indian bindi, something like that you can include. Maybe bindi will not be suitable for all, but once in a while you can include it. Instead of beetroot, it's not recommended on a daily basis. That's what I mean to say.
Okay. Sir, just one more question. So usually in the winters and all, we are the professions where the first to leave the home early in the very morning.
Okay.
Actually it is will be very cold, and these days the winters and even the rainy seasons are very cold. But you have said that the mustard oil can be recommended for cooking, right?
For people who are
For
used to
winter.
it, like in North India, they only use that very frequently.
We
So,
don't.
yeah.
So I need some tips for the inner warmness, because I want to avoid coffee and tea to keep myself warm. Any other thing that I can keep myself warm?
See, if you are not having gastritis or any hyperacidity, you can boil tulsi with water and take it. Little tulsi you can add, little pepper you can add, and this dry ginger. As for acid balance, you can add little this muleti or eshtimadu that you can add, and then make a drinking
Mulethi
water.
is fine, sir. Mulethi keeps our body warm.
Not just muleti, but I just told it for acid balance. But
Okay.
muleti here I meant for health of throat health. For throat health, muleti will do a lot. So you mix dry ginger. Maybe a recipe you can make a note of it. Dry ginger, um, maybe dry ginger 1 part, this tulsi 0.5 part, and pepper 0.25 part, and muleti 0.5 part. That you can make a recipe and you can prepare a drinking water using that.
Okay. So if we are acidic, we should avoid. Otherwise, we can go with that.
Yeah, acidic
Okay.
means better avoid too much of tulsi also, because that can cause
Okay.
hunger quickly, and you may have get some food craving sometimes if you are pitta based body.
Okay. So last question. So it is not for our inner food, but for our outer presentation is also very important in the school.
Okay.
So like, after nowadays where everyone knows that just after 25-30 we start getting gray hairs. So now actually there's a lot of confusion in the social media and outside advertisement like mehendi, indigo, this, that. So any one tips for our gray hair to stop it or to just cover it?
See, gray hair is because of pitta actually. So when we want to
Okay.
manage the pitta, it is twofold: internal and external. So externally, there are various types of oil. Like if you don't catch cold, if your body is heat-based body and you don't catch cold, then you can use some oils which can help in reducing the gray hair. But it will take some time. And if you are really not much affected by cold, you can use this amla hair pack. Amla hair pack is very good for prevention of gray hair, or
Okay. Okay.
reducing the gray
I'm
hair.
done.
Amla is good in that aspect, but very important thing is it is very cooling, so you need to be very careful. And
Okay. Okay.
there are other oils also like Bringaraj tail and some Neeli Bringadi, or so many oils are there that can be used. And then internally reduce the amount of salt and spicy content. Salt should be reduced. Include more of this what do you call, very bland diet should be used, and internally prepare recipes containing amla also, like amla rasam and this amla raita, something like that. Because this amla is good for immunity, it's good for reducing pitta, and it's very specific for scalp health.
I also heard it is good for reducing cholesterol. Is it so, sir?
Yeah, yeah, supposed to be good for cholesterol also. There are some brands selling amla with garlic for cholesterol management. But
Okay.
see that that's it's all it. When you come to Ayurveda, the diet is equally important as medicine. So that's why many people don't get the desired result immediately. But when you go to modern medicine, the cholesterol medicine is given. The patient may not be so great in diet control, but the results are there within few weeks. So the just I want to make this difference because tell this difference because amla is good for cholesterol, but not unless we follow that strict diet rule and lifestyle change. We need to be sure about that.
Okay, sir. Thank you so much,
Good
sir.
evening, sir.
Yeah, good evening.
I have flat foot problem.
Okay.
I came to know only 10 years back, and I was suggested by a ortho doctor to wear some special arch foot chappal. That only
Okay.
I'm wearing for past 10 years.
Okay.
Suddenly, after the summer, I got ankle swelling. I thought it is some kidney problem. I went for some test. They said nothing. But I went for Siddha treatment for 3 weeks. Swelling did not reduce. So again, I went to allopathy only, no other go. So they gave some medicines and more of like vitamins, multivitamin, like that only they have given. But they have given a supporting brace like thing to wear up over the ankle. Just I'm wearing that.
Okay. How is it now?
Nowadays, uh,
How is it now?
uh, if I reduce my walking or climbing upstairs, it is better. Sometimes in the school, the work will be more. Weekends, I just rest my foot. I feel better, and I have to walk at least 10 minutes walk. I have to do in the evening. That I am
Your
doing.
skin is sensitive or non-sensitive?
Sensitive in the. I
Means
don't understand.
you get any boils when you go out in the sun? Skin boils you get?
No, 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 not like
I am
that.
typing a medicine for you. Just you can use it for external application
Ah,
with warm water. Okay,
yes.
so that will help in reducing the. Have you applied any powder as a pathimas kind of thing for this?
Yes, they gave in Ayurveda shop some powder. I added with kungalium oil, kungalium thailam.
No, no, no. That should not be added with Gunguliyam Thailam. This should powder should be added with hot water or
Okay.
uh, or tamarind water. But hot water is okay. That is enough.
Okay.
That I'm typing for you on the chat window. You can see that.
Yes, sir. I will
Maybe
see.
you would have used it already, but just I'm right. Yeah.
The same thing they
And
gave in
more
the shop, sir.
importantly, I was telling you some suggestions, right? Keep a pillow under your feet while sleeping. While
Yes.
sitting in the school, try to use a stool if possible. I don't know if it's possible, but keep it extended. Keep your leg
Yes.
extended and sit.
Uh,
And then don't stand for long hours. Keep walking, and then apply oil while going to while before taking bath every day. Apply hot oil and then do it.
okay.
Wash it with warm water. So these things, and
Yes.
night also you can keep your oil application can be done, and then keep the feet in hot water containing salt, so that these things can
Yes.
help in reducing.
Okay, sir.
Okay,
But this will be a permanent problem or
it will go off. It is a lifestyle problem. That's why I had said about it. So it's a lifestyle problem, but based on these remedies, you will get some relief definitely.
okay, okay, sir. Thank you, sir.
Okay,
Thank you so much.
okay.
So there are some questions in the chat box.
Chat box. Okay, just a second.
Yeah, where you suggested Kottam Chukadi. So, teacher Emuna is asking, please suggest Ayurveda treatment for osteoporosis and weight reduction.
Sir, osteoporosis and weight reduction. This I don't know this about Perandai, this Hadjod. That is very good for osteoporosis and weight reduction. But apart from that, you need to take some Ayurvedic calcium supplements also internally, medicines also internally. In case if you need an oil-based medicine, you need to take that also. But after understanding your problem directly, I can recommend better. So if you can just connect later on, I can suggest you exact medicine for that. Yeah.
Any other questions from anybody? If possible, can all of us switch on our videos so that everybody can see each other and we can have a screenshot? So there is one more question from Mr. Subramaniam Pathasarthi. I think he joined just now.
Yeah, we
Is
can.
there any medicine for
Sir,
vertigo related issue?
we have cure for vertigo. Definitely, we can connect and we can suggest you good treatment for that. As I said, no, you can also watch the recording later on. So this oil to be applied on the scalp, no, it can prevent vertigo also. There are various medicines for that also.
Sir, one more question, sir.
Yeah.
So actually, I'm very, very sensitive to the rain. Suppose if I just drench for 2 minutes also in the rain, I feel a lot of shivering. Is it any deficiency syndrome or like we say Vayu Tattva, Kapha Tattva, is something is dominating or how is it, sir?
No, you are not able to withstand that chillness. Mostly,
Yes,
that's the only
yes.
thing.
I feel too chilled compared to all others. I feel too chill.
Which means that you need to make some changes in your diet, reduce the use of articles which are very cold, like for example, do you get throat problem very frequently?
Yes, sir. Yes.
So better reduce the use of buttermilk, and also
Um,
reduce the use of sweet items.
Sweet items.
Try to make it, don't be too spicy also, just have a balanced diet. And as I said, no, did you have asthma in your
No,
childhood?
sir. No, no, no,
So, do you get breathing difficulty?
no.
So there are some oils like this. I'm typing on the chat window. You can you apply coconut oil, right, for the scalp.
Ah, yes, sir.
So
Yes.
this oil is coconut oil based, and you can use it for regular hair oil usage. This can help in your prevention of this chillness also over a period of time. And as I said, use that combination of drinking water. That will solve the problem.
Okay. Tulasi Adi. Okay,
Yeah.
sir. Tulasi Adi Keram.
You are based out of Bangalore, right? So you will be getting
Yes,
it
sir.
in
Yes.
Kottakkal agency nearby somewhere, whichever.
It is for external apply, sir.
Scalp application, just like hair oil, you
Only
apply
for
it. That's all. Just
air.
apply it
Oh,
few
just like.
drops in the center and remaining. And also one more thing, every day apply this powder after you come out of bathing, whether you take head bath or not, apply one pinch of this powder center of your scalp. That will also regulate the heat temperature in the head, and these chills and all will come down. Okay.
Okay, sir. Okay.
Okay.
Thank you, sir.
Thank you.
In case of any further queries, you can contact the doctor in the number given in the chat
You
box.
can connect
I
me on
repeat the
WhatsApp,
number,
right?
it's
Okay.
8939933150. Yeah.
Okay. So
Sir,
shall
before
we?
we close the session, can you throw some insights on what Ayurveda says about? Sir, before we close the session, can you just throw some insights on what Ayurveda says regarding the eclipse? We have a lunar eclipse today.
Yeah, that's what I'm also in a hurry to finish it off because of that. See, this lunar eclipse restrictions are based on the stomach. The food content in the stomach should not be there when the eclipse happens, and that's why there is a restriction that we need to eat before this time. And in those days, they used to take very heavy meal. The meal was just twice a day. So the heaviest meal was before 12 p.m., ideally before 11:30 a.m., which I was just mentioning in the slide. And a slightly lighter meal towards before sunset, they used to take meal. So the heaviest meal in the morning was such that it took a lot of time to digest, say about 4 to 6 hours for them, for the kind of, they had the kind of physique and the kind of very good metabolism to digest that. But now, still it holds good. Still that rule holds good because our metabolism is also not that great, and our food intake capacity is also not that great. It holds good even now. But apart from that, the other reason for restricting us from taking food during the eclipse or few hours before the eclipse is the essence of the food which goes from the stomach to the rest of the body tissues. That essence needs to be a real essence. It should not be a mutated one. When you do this, when you take food or when the food content is there and the digestion is happening during the eclipse, then the cellular health will really get affected. It won't show anything immediately, but probably there are not much references about it. But Ayurveda says that during the eclipse, better not to uh, not consume food before few hours, and not to even open the book and learn something. Avoid, just chant, just chant. And in yogic perspective, they say it is a time when we need to introspect and look inward, and just concentrate ourselves in removing the darkness, so that by the time eclipse goes off, the darkness is removed, and enlightenment happens. So that's what.
Yes. So can I add on one point, any important message for all the teachers, if you
Yeah.
don't mind? Yeah, so actually, basically, I'm learning meditation. Actually, it's not learning; it's a process to happen. So it is a very, very good suggestion to do meditation on a regular basis for every teacher. The reason, only thing, from morning to till the last, like no, come out of the school, we continuously talking. We'll never be restless. So at least 10 minutes in a day, we have to keep for thinking inward. It's not thinking just to have to keep ourselves zero thought. So I just suggest for everyone to keep ourselves zero mind at least for 10 minutes in a day. That actually has brought up a lot of changes in me as I've been practicing from 6 months. A lot of changes I can see in my health also, and even in the thinking process transformation. And I suggest the same thing today. Even in the actually we receive because I'm a meditator, I know few points on that. So we get a lot of good cosmic energy also on that particular time of grahan. So it is like both positiveness also is there, negativeness also is there. So during that period of that duration, I it is a good thing to do that. You just have to sit quiet, and as sir said, we have to be go inward. So in going inward is nothing but just focus on your breath. Just focus on your breath, and if any thoughts come to you, just let the thought come and go. Don't focus on that. Just focus on the breath and just keep your thoughts zero. So it will helps you a lot. It's an everyday process. If you practice, you can just see lot of changes both in physical and mental aspects. Thank you, sir. Thank you.
Thank you so much. Thank you. Yeah. So there were some questions on the
Thank you for your suggestion.
chat window. So I have replied to that. So we just conclude here. Hope we have more people joining us in case we conduct a program in future. because we had a lot of registrations, but only 12 have turned up, including me. Okay, so let me complete the session with a prayer for universal betterment. Sarve bhavantu sukhinah, sarve santu niramayaः, sarve bhadrani pashyantu, ma kaschid dukkha bhag bhavet. Om shanti shanti shanti. Hari Om. Thank you. Thank you.
Thank you so
Thank
much,
you.
sir.
Thank you so much, sir. Thank you so
Thank you,
much.
teacher.
Thank you.